The numbers are sobering and they're updated twice a day. The number of cases and the number of deaths.
But Sean, there is another number that's also worth paying attention to. The number of people who have recovered from coronavirus, like me. More than 1 million people worldwide, almost 200,000 here in the U.S. And for those of us who have recovered, we have a job to do. The vast majority of people who get coronavirus will make a full recovery. It took me 2 full weeks to get better. And once I did, I started reading about something called convalescent plasma. That's plasma that's taken from people who have recovered from the virus.
When we take that plasma and we transfuse it into someone who still has an active infection, the antibodies will attack the virus essentially and help it to clear from the body faster.
Dr. Bialaski is with the American Red Cross Georgia region. She says plasma from those who have recovered can be a lifesaver for the sickest COVID patients.
It gives them a real chance.
My first stop was to the American Red Cross website, where I filled out a donor eligibility form. Until recently, donors had to show proof that they'd tested positive for COVID-19. But since there are so many who had symptoms but never got tested, people in that category can now donate too. Their blood will be tested for antibodies that showed they had COVID-19. A local Red Cross worker soon called to help me set up my appointment. Which brings me here to the American Red Cross Midtown Donor Center. I've been told to eat a healthy breakfast and prepare to be here for about an hour. So let's go.
Hi, welcome to the Red Cross.
Thank you.
Okay, give me 5 good squeezes.
This is a little bit different than a typical blood donation. In this case, they're only interested in my plasma. So this machine removes the plasma, and then everything else gets put back into my body. After all the suffering I went through, I was praying that something good would come of this. And can you think of anything better than possibly saving other people's lives? So those of us who have been through this and recovered, this is our job now. This is how we help our community. And it's not that hard. At the Midtown Donor Center for the Red Cross, I'm Rick Fulbaum, CBS 46 News.